develop serious blood clots. So they are not as immune as they think. They may not have comorbidities, but there is growing evidence that the younger age group, that cohort in Trinidad, that 25 to 49, is that 29 to 49?
25 to 49.
Globally, we haven't seen it here yet, but they are coming down with serious strokes, serious cardiovascular events due to blood clots. I don't know if you want to expand on it from a medical perspective.
From a medical perspective, one of the things that happens with the endothelial system and with the levels of various hormones that affect blood circulation and the tendency to clot, those get thrown off by the infection with the virus altering bradykinin levels and other aspects of physiology that are maybe a little too complex to go into in detail. But suffice it to say that the evidence from the outcomes has indicated that clotting-related events, including strokes, including heart attacks, including the COVID-2s that we were seeing, vascular events, all of those things may be related to that cascade of hormones thrown off by the infection. Again, we're not entirely sure how or why that happens because the virus is new. But as we gather more information, we can provide guidance on additional risks and hopefully additional strategies for reducing risk.
Thank you very much, Dr. Hines. And now we move to TV6, please.
Good afternoon, Urvashi from TV6.
Good afternoon.
I'd like to know tests submitted since August 29th have fallen to less than 1/3 of what it was in the middle of August. Can you tell us why? So that's one. And two, in your roundup, you mentioned that there is 58 suspect cases and these are persons who are still serious enough to require some level of hospitalization. I'd like to know why priority wasn't given to getting back their test results in particular, because they were obviously in hospital more serious. And then once we are onto the solidarity trials, getting the test results in quickly will, impact that they have options as to treatment. Thank you.
Sorry, could you just repeat your second question? Just straight to the point. Repeat the second question.
Your audio is going in and out.
It's regarding the 68 suspect cases in hospital. Why can't we prioritize their results so that if treatment options become available, they can access it?
Thank you.
Treat the patient.
Okay, I'm going to take the second bit first because I'm not sure why the misunderstanding lingers that the test result in some way affects their treatment options. It does not. These individuals are already in hospital. They are already receiving the supportive care that is indicated and required by the physiological conditions, by the monitoring that is happening for these persons in the hospital where they're receiving care. So I'm not sure what the angle is with regard to asking about if treatment options become available, or the treatment options that are available are currently being given to those patients. The question on the number of tests between August 29th and I'm not sure what date, you might want to repeat that, being reduced. Again, I don't quite understand where the question is coming from. We are now at September the 8th. What we are doing is reducing the backlog, and you're seeing smaller numbers of tests from further back because we're more up to date with completing all of the tests. We still are contending with that throughput capacity limitation where more tests are coming in than there was capacity to complete tests within a given day. We are expanding the ability of the testing system, the laboratory system, to have more tests completed within a 24-hour period. So what you would expect is that tests from further back are becoming a smaller proportion of what is being currently tested. So unless I misunderstood the question, the clearing of the backlog would reduce the number that we are accounting for further back, and we are still testing basically at full capacity because we are still getting as many tests as we can handle per day and slightly more. And we're expanding the capacity to do testing on a daily basis so that we don't continue to incur backlog.
Okay, thank you very much. And last questions today, very quick and brief, please, from Newsday.
Yes, good day to the panel. Julian News from Newsday. My first question, very quick. Minister, you mentioned 700 tests from the backlog have been cleared. Just want to get what is the balance, if you could give me that, still to be cleared. And secondly, we've gotten some reports from some concerned citizens whose relatives have gone into the system, tested positive and so forth, and sometimes days, sometimes up to 8-9 days before they can get a response. What is going on, what is their status and situation. I'm wondering, is there an issue with communication with these relatives? And if yes, is that being addressed?
Okay, so I'll take both questions. So in my update this morning, we got that 700 cleared. I have asked them to give me the information on the backlog. I could have that for you, hopefully on Saturday. Yes, I had a meeting with North Central RHA yesterday, and I'm having a follow-up meeting with them at 3 o'clock this afternoon to address that same issue. I am not happy with the level of communication that is being given to families of persons in Couva. It is concerning me. I have a meeting this afternoon with the chairman of the board, with the CEO, the operations manager, to solve that same issue, because it is a concern to me that the level of communication to families needs to be improved. I admit it freely. It came to me and I'm attending to it, and by hopefully 3 o'clock this afternoon we should have a plan going forward to deal with that issue.
Thank you very much, Minister. We have come to the end of today's media conference. We are very happy that you tuned in this morning. Please remember that your mental health is just as important as your physical health. Have a good day, everyone.